So an orthoptist is an allied health profession that works in the field of ophthalmology, most often in pediatric ophthalmology and adult strabismus. So most often we'll work either in conjunction with a pediatric ophthalmologist or a neuro-ophthalmologist, either in clinic with them or seeing patients independently under the umbrella of one of the pediatric ophthalmologists. I personally see patients here about half the week with one of the pediatric ophthalmologists and then a couple of days a week in my own independent orthoptic clinic. When I see them independently, I'll see them and come up with a plan of treatment and where to go from here. And then one of the pediatric ophthalmologists kind of oversees that care and kind of makes sure that we're still on the right track. So for the most part, I see a lot of pediatric patients, just the nature of ocular motility problems. So we see mostly pediatric patients, but I see a lot of adults as well who have double vision problems. Those can be some of the most rewarding patients because they have double vision and oftentimes we can make them a lot happier. Sometimes just with glasses, oftentimes with surgery as well. As far as I know, I'm the only orthoptist here in Spokane. I think I'm the only orthoptist for quite a while in the region as well. Seattle has a few orthoptists, Oregon, Portland as well. I think next to that, probably Montana, Boise has an orthoptist as well, but there aren't too many of us. We're kind of few and far between and spread out. The most common conditions I probably see are children with amblyopia. So that's one eye that doesn't see as well as the other eye for a variety of different reasons. I see patients with strabismus or eye misalignment. I see lots of kids with strabismus. I also see a lot of adults with double vision and ocular motility problems and help them and treat them either with glasses or refer them for surgery to one of the pediatric ophthalmologists. So here at the Spokane Eye Clinic, someone comes to see me as an orthoptist if you have already seen one of the pediatric ophthalmologists. Often you may have seen me in clinic with them, and we might decide together, or they might decide that the next best step is to see me for a follow-up. And you might see me for a few visits in between and then go back to see one of the pediatric ophthalmologists for your annual exam. You may also be referred from one of our other internal physicians here. You may have had cataract surgery with one of them. You may have been referred from one of our glaucoma specialists, an optometrist, or one of our retina specialists. If you're struggling with double vision, they might refer you to be seen by me and see if you need glasses, prism in your glasses, or need to be referred for surgery. My name's Felicia Korpi, and I am the orthoptist here at the Spokane Eye Clinic.